Hi, today I will just briefly touch upon the correct age and timing of hypospadias surgery in children. I have spoken on this topic earlier also, but I think this is an important question and many parents are still not sure as to what is the best age and timing for their child's hypospadias operation. Now, as we all know, hypospadias is a very common problem and it's a very important problem because it deals with genital organ of boys, and treatment and surgery has a lifelong impact on not only the child but also the family. So there are many, if you go into Google, if you go into the internet, most of the articles or most of the opinions say that the ideal age for hypospadias surgery is between 6 months to 1.5 years of age. Again, there are some scientific reasons for saying this, but practically speaking, in my practice, we typically tell the parents that the simple way to remember is it is better to repair the hypospadias before the child goes to school. So that is by 3 years of age, if we can fix the hypospadias, that is more than sufficient. Of course, I typically do not operate in 6-month or 7-month-old babies for hypospadias most of the times because the baby is very small. The Indian children are not as large as the Western children, so the weight may be small, and the penis may also be very small at that age. So a small penis increases the risk of complications after hypospadias repair. So what we do is, I typically wait till about 9 months to 1 year for the child to grow and the penis also to grow. So I typically advise surgery somewhere between 1 to 2 years of age. Most of my patients are operated between 1 to 2 years of age. Of course, we operate at 6 or 7 months also. If the baby is of good weight and the penis is of good size, we have no problem in operating at 6 months or 8 months. But most of the time, our children, by the time we plan surgery, they are between 1 to 2 years of age. But a simple way of putting it is to at least do the operation before the child completes, so that by the time they go to school, they can stand up and pass urine into the toilet just like other normal children. Otherwise, when they go to school, if they pass urine from the undersurface of the penis, sometimes the urine dribbles into the school uniform or the undergarments or the clothes. So they may have problems in the school. So that is one of the main reasons why we advise this. Of course, a lot of children come to me beyond the age of 3 years. We operate even on 5 years, 10 years, 15 years. I even do quite a few hypospadias operations in adolescents and adults also. Of course, most of them are not first-time operations. They probably were operated multiple times during their childhood and failed. So most of them are redo operations. But occasionally I see an adolescent or an adult, even an adult, with completely uncorrected hypospadias. So they have lived into adulthood, but they have a lot of psychological issues, and I would not really advise that the parents should wait for the child to grow into an adolescent or an adult before undergoing this surgery. So I would say the best age for surgery is somewhere between 1 to 2 years or 1 to 3 years. So better to complete it by the time of 3 years if possible. Thank you.